Hello everyone, I am Dr. Akshay Hari, consultant neurosurgeon and spine surgeon working at Aster CMI Hospital, Hebbal, Bangalore. Today I'm going to be talking to you all about surgical solutions for scoliosis and what it's all about. So scoliosis is the medical term for an abnormal curvature of the spine. It may range from mild to moderate to sometimes even severe. While most mild to moderate curves may not require any major intervention, it is these severe curves that may require surgery. Any curve more than 40 to 50 degrees has a higher risk of progression during the entire lifehood of the child, and these curves may require surgery at some point. Left untreated, these larger curves can pose serious health concerns such as complications, difficulty breathing, compromise to the lungs as well as the heart, and sometimes they may even lead to neurological complications. The other side effect of these large curves may be that they may also be quite cosmetically unappealing for the child, especially among the peer groups. Surgery in such cases may be necessary, and if it is indeed required, may actually be life-changing, because being a significant procedure, it does carry certain risks as well as benefits. So when is surgery recommended? Surgery, like I already mentioned, is recommended for those children whom scoliosis is already progressed to a large extent or whose curves are more than 40 to 50 degrees. These curves have a tendency to progress even after the spine has completed to grow, and they may pose certain health concerns, as I've already mentioned. Being a progressive condition of scoliosis, surgery is actually the only definitive way to correct it and prevent progression and arrest the curve at its early stage itself. So what is scoliosis surgery all about? Well, the scoliosis surgery, it actually involves three basic stages. One is the incision that is placed in the back and the spine is actually exposed. The next step would be the most important step, where screws, which are metal implants which are placed into the vertebrae and are interconnected with rods. Then by utilizing specialized techniques and technology, the spine is actually reoriented and individual vertebrae are corrected to be oriented in the correct method. While the curve need not be corrected completely, it is essential that the curve is at least corrected to less than 25 degrees so that a proper spinal alignment can be maintained. Of course, it depends on the flexibility of the curve and the severity of the curve. That is why early detection and early treatment is essential. The last stage is placing bone graft. When bone graft is placed along with the spinal rods as well as the screws and metal implants, a proper fusion is then achieved, where all the vertebrae which are involved are entirely fused to become a single block, and the spinal curvature is completely prevented from progressing. So is surgery really safe? Well, nowadays technology and techniques have improved tremendously to improve the safety and efficacy of surgery so that the overall outcomes are actually improved. Nowadays, with the improvement in technology such as three-dimensional intraoperative imaging as well as intraoperative neuromonitoring, the overall safety profile has been tremendously improved. Spinal cord and the nerves are continuously monitored during surgery, as well as relatively real-time imaging is obtained during surgery so as to obtain the best results. So what to expect after surgery? So the first 1 or 2 weeks after surgery would primarily focus on rest, recovering from the pain as well as healing from the surgery, as well as simple short walks and simple activities may be allowed. The next 3 to 4 weeks would focus more on gradual return to normal life. You can even return to school once the wound has healed and once the pain has improved. Children are encouraged to start doing about their normal activities and even schoolwork. The next couple of months would require a close follow-up with the surgeon as well as the physiotherapy team, because from the second month and up to 6 months, a gradual increase in the physiotherapy and levels of activity is generally encouraged. Children are also encouraged to run and even take part in simple non-contact sports so as to return back to their normal activities. The next couple of months, from 6 months to 1 year, is usually focused on regaining strength and stamina. With help of physiotherapy and return to normal activities, as well as simple sports like swimming as well as running, children are encouraged to return back to their normal life. During this time, the focus is on improving flexibility as well as the strength of the spine. So while the patients usually return back to their normal life by this time, fusion would generally take up to a year to complete. So remember, scoliosis surgery can be a transformative experience. With the right preparation, knowledge of the recovery process, as well as a skilled medical team, you can approach scoliosis surgery with more confidence and lead a more happier and fulfilling life. Thank you.